Yeah, so we've been training dentists now in providing skin services and looking at more than just teeth and gums for probably the last 10 years. But in the industry it is still relatively new, particularly things like driving this general health message and screening for skin cancer. But when you think about it, dentists see more patients than any other health practitioner when they think they're healthy. So we do checkups every 4 to 6 months, and as part of that we're now encouraging dentists just to ask the question, do you use sunscreen every day? To help combat some of the statistics we're seeing from the Cancer Council, 2 in 3 patients before the age of 70 in Australia are getting some form of skin cancer. So dentists with further training, and that's where our academy comes in, we train dentists in skin services, are able to identify and screen for some of these issues. Now we're not saying that they become specialists in diagnosing skin cancer, but it doesn't take much extra training just to spot that something looks suspicious in a general checkup and then refer it on to a dermatologist. Dentistry has changed a lot, and we now look at the whole head and neck area and we take photographs as part of our usual routine of treatment, and we can track those photographs. So what we're asking dentists to do is now really step up more into a general health screening and preventative role rather than just teeth and gums, and really use their expertise of the head and neck to help their patients way more than we used to. In our member base, and we've got 3,000 dentists across the country now, we have had several cases now where they have screened their patients in a general routine dental examination, found something suspicious and referred it off, and it's turned out to be a basal cell carcinoma or melanoma. So beyond just the teeth and gums, these dentists have ended up making a real impact in these patients' lives.
The Australian Dental Association encourages all dentists to play that important screening process role, and that's usually something that dentists will do at their regular checkups and cleans. We have the opportunity to review and assess patients on a fairly regular basis compared to a lot of health professionals, and that screening does not just involve the teeth and inside the mouth. It actually starts right from looking at the skin and the soft tissues of the whole head and neck area. So that screening role is a really vital role that dentists can play.
Have you heard of instances where dentists have actually spotted melanomas?
There have been quite a number of instances where dentists have picked up on changes in skin that have turned out to then be either early cancerous lesions or full-blown melanomas. So we've been part of that screening process for a really long time, and so we're just encouraging dentists to keep playing that role and keep educating patients on sun safety.
What advice will you give? What advice will you give a dentist if they believe there's a skin cancer?
So dentists are aware that
Hang on, sorry.
No?
What advice will a dentist give if they believe there's a skin cancer?
So dentists' role as part of the screening process, if they do notice any changes in the skin or anything that they believe might be suspicious, is to provide the patient with a referral to see a specialist so that that area can be investigated further. And not all instances are going to be situations where it is a cancer, but it's just making sure and giving that patient the peace of mind to either get onto it if it's early detection or to just double check and make sure that it's nothing sinister.